Welcome to the campus of Texas Southern University, where it is our mission to educate and serve the community. I'm Ken Huewitt, interim president of TSU. Thanks for being here on this beautiful rainy day. We are honored to partner with St. Luke's Health for the COVID-19 vaccination site here on our campus in the heart of Houston's 3rd Ward. The Texas State Legislature gave TSU a special purpose designation for urban programming. Public services is a major part of that special purpose designation. This site exemplifies our relevance in providing solutions through partnerships like this one with St. Luke's Health. As the proud leader of this historic institution, I would like to leave you with one word for today: access. Access to health care, education, and opportunity is critical. We are proud for the coming months to be an access point in the city of Houston to serve the vulnerable communities we serve who meet the requirements for this vaccine. I'm going to take a moment to recognize my Board of Regents, and in fact, I'll ask the Chairman Albert Myers, to come up and say a few words first, and obviously introduce my esteemed leadership.
Thank you. Thank you, Mr. President. I've gone to 2 of these, or 3. I can't remember how many I have on, but hopefully you can still hear me. I'm just trying to follow guidelines instead of 1, instead of 2, instead of 3. Mayor Turner, Congresswoman Lee, she's not here, I don't believe. State Representative Ms. Thierry, he was going to be here, he's not here. Commissioner Ellis, Mr. Lawson from St. Luke. A couple of people that are not here that I have it right here. Councilmember Shabazz, and we have several members of the state legislative body that could not be here. Representative Dutton and Representative Coleman and our distinguished Senator Boris Miles could not be here. And I want to just have a couple of comments on their behalf. They are tirelessly working for this university and extremely proud of what we're doing here today. And unfortunately, they could not be here, but I cannot say enough about these folks, about what they're trying to do for Texas Southern University right now as we go forward, as we push the dial here north for this university. Let me acknowledge my colleagues on the board, Regent Page, Regent Medina, and Mr. Benham. Regent Benham, is everyone here? Everybody can say hello. Let me also suggest this to Mr. Lawson, okay? Within the overall strategy of the city, of what this mayor is doing for this city, it's been one major task to sort of get this under control, and we don't have it under control, but we're moving in that direction. For your organization to take the initiative to locate a station in the heart of the city, in the heart of this community, around Texas Southern University, I applaud you and your people. Okay. It's one thing, you know, when you're trying to, as the mayor is trying to do for the whole city, but if you can't get the heart right in the middle of the city for the people that are in the most need, and I think over the last 3 or 4 days, we've seen articles, news reports about everything around brown and black communities not receiving the services needed. And here we are today. Step 1, I'm sure the mayor would agree, and you will agree, can't be the last step, but it is step 1, and we got to start somewhere. Because I imagine just as soon as we're sitting here right now, we can use many more of these across this city, as you know, Mayor. But for this community around Texas Southern University, I am so happy, so proud to be affiliated with this university at this time for the right reasons, at the right time of what we're doing. So I want to make sure I suggest that. Now, one other thing. Your staff, can't say enough about your staff. I received one phone call from a young lady named Tammy Lanier. She said, we need to locate something in the city. Would the university consider this? I made one phone call to the president and another young lady named Miss Spalding, Melinda Spalding. Here we are again today. What I'm trying to say is that it should not be off of the radar that this should not be expected by this university. We should be doing this. We should be in the middle of this effort, and we are. And this is what we're trying to do going forward with the university. So I want to thank you and your staff and all of the healthcare workers here for leaving other sites, coming to this site, leaving your families, regulated time and overtime and everything else that you're doing to be here, because it's going to be busy. If you saw what has taken place in the last 36, 48 hours, the need outweighs everything that we're probably going to be able to do. But I'm glad that you're here. And I thank you for your staff and everybody. And I turn it back to the president. Thank you so much.
You know, I should just say ditto to your remarks and then move on. But before I turn it over to St. Luke's and the elected officials, I too would like to take this opportunity to say thank you to a number of people. The Episcopal Diocese of Texas for making the initial connection and including Right Reverend Andy Doyle and Tammy Lanier. I too want to say thank you. Representative Sheila Jackson-Lee, Mayor Turner, State Senator Boris Miles, State Rep Shawn Thierry, Harris County Commissioner Rodney Ellis. I mean, the list goes on and on for those that I'm able to consult with about what we're doing here. And again, Mr. Mayor, I talked to you right away after this happened, after I saw your news conference, and was thankful that we could be part of the solution. And again, when this fell in our lap, we were so thankful. I'd like to also just again my reasons for supporting me in this interim role. Thank you for your support for being here as well, and showing your support for this center being here. Last but not least, all of the TSU staff and the St. Luke's frontline workers who have been here for 12 to 16-hour days during our soft launch of this process. And again, we're not there yet, but it's not from a lack of effort on those individuals. And I can't thank you enough. You've definitely been serving with kindness and patience, and it shows. I mean, I've gotten nothing but positive reports about any interaction that they've had with TSU and St. Luke. So yes, if you all could just raise your hands, do something, let people know. We'll make sure we have some photos of them and make sure we put it on our website. Now, it is my pleasure to introduce the CEO of St. Luke's Health, Doug Lawson.
Thank you so much for providing me an opportunity to say a few words. The first thing that I'd like to say is we would be remiss if we didn't take a moment and, as mentioned earlier, recognize the heroes in our hospitals and our clinics that are caring for those that are suffering from this virus, that are being afflicted by this virus, and are fighting every day to save lives. And I'd like for us to take a moment and recognize our nurses and our doctors and our clinicians. Thank you. The second thing that I want to say, and that is with a lot of sincerity, is we have two of or a handful of our top executives who have made this their number one priority to reach out to and partner with TSU in this community. And that's Liz Youngblood and Dr. Brad Lemke, and I'd like to recognize their work in particular. Liz and I talk often, and if you ever really want to know who runs this health system, it's probably Miss Youngblood over here. But I'm calling Liz last night. I think it was between 7 and 8 o'clock at night to get an update. And Liz is talking to me, and she said, "Oh, stop, hang on for a second. I gotta help. I gotta do something." Well, there was a 90-year-old lady who was in a car. She'd been waiting there for several hours while her daughter stood in line for her. So Liz, who happened to be one of the last ones there, walked out, got this lady in a wheelchair, brought her into the clinic, made sure she was taken care of. Dr. Lemke and I were, again, talking late last night. Dr. Lemke made it a real point to tell me, and I could, a little shake in his voice, and called this one of the most important things that he's done in his career. Now, Brad is quite frankly one of the smartest people that I know, and one of the most understated physicians you'll ever want to be around. And if you ever have a difficult clinical problem, Dr. Lemke's ought to be on your short list. But I had the unique opportunity to represent an extraordinary organization, St. Luke's Health System and Common Spirit Health nationally, with a stated objective of making sure that we're reaching out to communities that are underserved, reaching out to communities of color, and addressing racial inequities in the healthcare that we're delivering. That work is incredibly important, and the work that we're doing today is another step forward in making life better for everyone. We've got a number of divides that we have to cross, a number of challenges that are in front of us, but every bridge matters, every step matters, and Mayor Turner has done an amazing job of helping bridge that gap. Thank you, Mayor Turner. My real job on a day-to-day basis is to lift up and recognize a number of really committed, passionate people who care deeply about the communities that we're called to serve. And today is truly an honor to step forward and say thank you to my team, the team that supports these communities, but also to say thank you to this crowd, this group, who is equally passionate about making sure that we're doing the right thing for the communities we're called to serve. So again, thank you for that opportunity. Mayor, I'm going to turn it over to you. Thank you very much.
I don't know if I'm going to stay with these prepared remarks. I may deviate from them. But let me start off by, Doug, thank you and your team, St. Luke Health. Can't say thanks enough, and I'll come back to that, but thank you so very, very much. To the president of Texas Southern University, President Huewitt, thank you. Appreciate the phone call that I received and the conversation we had over the weekend. And to the First Lady of Texas Southern University. There she is. I spoke to her first before I got to you. To the chairman of the board, Chairman Myers, always good to see you. We've known each other for a long, long time. And I agree with you, this is a monumental moment in the city. So thank you so very much. To the Board of Regents, can't say thank you enough. You know, you all are the caretakers. And if you will, since I deal with Trustee Stephanie Nellon's page on a daily basis, and she was just in my office yesterday. So let me thank her. She works for me for free. So thank you so very, very much. Let me go first over to the councilwoman, Carolyn Evans Shabazz. I can't say enough. It's just been a pleasure to work with Councilmember Shabazz. Just an outstanding councilwoman. 1 year seemed like she'd been on there for 14 years. So thank you. And we're in the district of destination, as she tells us all the time. So thank you. And then to the Congresswoman, the Sojourner Truth, the Harriet Tubman, the Fannie Lou Hamer, you know, the Barbara Jordan, but the Sheila Jackson Lee. And I'll come back to her very briefly, but you know how much we appreciate you and your leadership and your efforts, and your passion for the 18th Congressional District and, quite frankly, for Houston as a whole. So thank you so very much for being a champion. Let me highlight 2 events and I'll be done. Over the weekend, Doug, a number of elected officials from the congressional level, state level, city, county, school board came together to talk about access and equity, to make sure that when the demand is so high and the supply is so limited, and until the supply ratchets up, you want to make sure that as many people can get it as quickly as possible, but at the same time, you want to make sure that there is equity in getting it. And even in this city, when we look at the distribution, 43% Anglo, 21% Hispanic, roughly 8 or 9% Asian, 18% African American, the gap is still too much. And so on Saturday at the press event, it was about how do we address that, and collaboration is key. That was on Saturday. Then on yesterday, in a conference call that ended up lasting for about an hour and 15 minutes with the Vice President of the United States. In that conversation with a number of mayors and in the exchange that she and I had, what was central in that conversation, council member, was equity and access. That was key. And then to be here today, where we, even on Saturday, talked about the importance of our hospital systems collaborating and working with community groups. This is the manifestation, the public display of that sort of collaboration that will make a difference, that will save lives, and that will advance us to the point where we can return to some degree of normalcy, not just for some, but for everyone. So as Mayor of the City of Houston, I wanted to come here today, and I wanted to come here today to thank St. Luke Health for going beyond the walls of the medical center and coming out in the community. To put it in a better way, to come to the hood, in the 3rd Ward, in the tray, to make this vaccine available to everyone. So thank you. And to thank Texas Southern University for saying not only are you an outstanding institution of higher learning, but you also recognize the importance of there being equity and access for everyone, and providing a venue for that to take place. So when you combine St. Luke Health with Texas Southern University, then it is that public demonstration that that collaboration is taking place at the highest level, and that we can work together to make sure that this vaccine is distributed to people in the city of Houston, but especially to communities, to people who have been disproportionately impacted by this insidious virus. And so let me say thank you to your team. Appreciate that, because the very fact, yes, when you got a 90-year-old woman who can't stand in line, and you got a relative or daughter standing in line for her, and then Ms. Youngblood, Dr. Youngblood, for you to go and assist, it just demonstrates that we're all in this together, that all of us have a role to play. So thank you. This will make a difference. This site will make a difference. And then as we prepare to open up the mass distribution site by FEMA on the federal level, again, Congresswoman Sheila Jackson-Lee, you mentioned months ago, not just last month, but months ago, about federalizing this system and wanting FEMA to take a very active role. Well, it's happening. You filed the bill asking for FEMA to do it. FEMA is now doing it. We're talking about 6,000 vaccines are being given in a single day for about 8 weeks. That will make a huge difference when you combine that with what's happening here at Texas Southern and with what the city and the counties and others are doing. We are going to move this ball further down the field. So let me conclude by saying that when we work together And I do certainly want to acknowledge the Right Reverend Doyle of the Episcopal Diocese for his involvement. He's assisted on many levels on police reform. He was there. When it comes to this, he's present. So I want to acknowledge him. Tammy Lanier, can't thank you enough. Now you can stop calling me at 1 o'clock in the morning. But that's my friend, and I appreciate her passion. But for me, as the mayor of the city of Houston, let me tell you what causes me to stay up at night, even when I don't want to. And that is when you see communities that have been underserved and under-resourced for decades, operating at the margins, struggling every day for families to survive, and on so many different levels, whether it's public safety, whether it's health care, whether it's economics, they're on the margins and they're constantly battling, not just to thrive, but just to survive. And now here comes this virus, and it's impacting them even more. The question is, how do we provide them with the support that they need in order to survive and then to move forward in a very productive fashion? And in order for that to take place, it requires collaboration. And so that's why I am, Doug, so thankful for what's taking place, because the model that's being demonstrated here is a model that needs to be replicated on multiple levels. And I don't think you may fully realize the significance of what's taking place on the campus of Texas Southern University with St. Luke's Health. That will go way beyond when this virus has been arrested, contained, and eliminated out of this community. So on behalf of the city as a whole, let me say thank you. Now let's get it done, and let's educate some kids, and let's prepare ourselves for a brighter future. Thank you.
You know, earlier in my thank yous, I didn't thank you, Councilmember Evan Shabazz. Thank you for being here. And now I would also like to bring forward the Honorable Congresswoman Sheila Jackson-Lee, please.
Good morning. It's really a pleasure to be here with the maroon and gray and to see all the distinguished persons that have gathered here to be able to make a difference. This is a very fine example, Doug, of a public-private partnership to save lives. Let me acknowledge, first of all, in many instances, my partner in crime, the mayor of the city of Houston, who has been without ceasing, not only in what is a health disaster, but we have watched him through the years. We are grateful for a stand-up mayor who will stand up for the city of Houston. I think he is due another applause, if you will. Delighted to be here with the council member. We work a lot on many issues together. Congressional district overlaps so many different areas of this community, as far north as Humble, and then to the east of Jacinto City. So it requires a lot of attention to so many poor people. And I'm in no way shy of acknowledging that this is an eclectic district, but it has all the indicia that we see on the national level, needing to work with people who are in need. Let me thank the Right Reverend Doyle as well. Wonderful Ms. Lanier, who has a wonderful partner as well. Thank her for her leadership and vision. Want to acknowledge Sabrina Loeb, who is handling the site and made it known to me that this is her alma mater. And so she's excited about being here, Stephanie. To all of the trustees, even our newest member, former council member and mayor, I think, in Bryan or College Station, we're delighted to have you. Anybody that's been in local government, council member, is going to work hard for the university, and we're going to work him harder than he might imagine. He indicated that he's fundraising, and so I know he'll leave a check at the door. I do want to acknowledge our president, and I love calling him that, interim president, and as he well knows, some many months ago, I indicated my interest in this site being a FEMA site because I was projecting the crisis that was about to come, but how great it is for us to have now a public-private partnership with Texas Southern University, leaving the opportunity for smaller FEMA sites to go in other areas. Just want to remind everybody that the CDC has defined people of color as critical population, but yet our numbers do not reflect where we should be, because the CDC estimates that only 5.4% of those vaccinated are Black, and 60.4% of those vaccinated are non-Hispanic whites. So we're not just talking to be talking. We have a crisis on top of a crisis. The pandemic is a health crisis, but the fact that we're not vaccinating African Americans, Hispanics, and Asians at the rate that they should, with no disregard for the importance of vaccinating everyone. That is not the message of the Centers for Disease Control or any of us. As the local elected officials have worked and we stood with the mayor, let me highlight that the Congressional Black Caucus, now 60 members, of which I am an officer, and early on we began to talk not only to the Biden administration, but to the Trump administration about the stark disparities in those who were both infected, hospitalized, and died, in particular in the African American community and in the Hispanic community. In fact, when this disease first started, brought over from Europe in New York, most people didn't get it. The highest number of people dying at that time were African Americans. It went to New Orleans, African Americans. It went to Detroit, African Americans. It was rampant. And we know that almost 500,000 have died. Medical doctors believe that we may have about 600,000 dead by May. If we in this community can be a bright and shining light, to be able to be an example for that public-private partnership, what an amazing, life-saving opportunity and journey we will be on. There are almost 3,200, 3,100 dying every day. January was our most deadliest month. These are not good numbers. It's not a good news story, but it is a story of truth. And the good news is that we're here today. Mr. Chairman of the Board of Trustees, we're here today with solutions. That's why I think this is such an important moment, that we're here with solutions. And it would not be appropriate if we left the numbers and the devastation that is being faced by families off the table, because it is not good news. I think this is important for the state of Texas because we're still a hot spot. There are 2,187,000 cases, almost 40,000 dead, and our infection rate continues. Harris County has similar proportional numbers. So we're not where we need to be. And when you see seniors, super seniors, over 75 years old, having the opportunity to come in their neighborhood, because this is their institution, this is their home, this is where they graduated from. Just a few days ago, we were celebrating Henry Doyle, the first graduate of your law school, before it was even integrated, or when I say integrated, before it was even a recognized institution. It wasn't Thurgood Marshall, but he graduated in 1949, Mr. President. So this is the heart of our community. And I would encourage St. Luke's to not only be a collaborator and a partner, I would encourage you to be a messenger, because you're an anchor in the Texas Medical Center. There are multiple facilities. Can you imagine if the other facilities collaborated with those of us who've been on the battlefield for so long? What an amazing spread we could determine and provide these kind of satellite sites all over the county and the city. And I can assure you we'd be standing ready to help you. In fact, if both of us were in the military, I would salute you right now. Because that would be an amazing response. And if I leave anything as I leave this podium, we've got to respond. That's what we've got to do. Because otherwise, we won't catch up. The CDC now wakes up, and they've got something now and something another day. Now we're all wearing 2 masks, so I'm going to hold you in contempt, but I'll get one for you. But it's not your fault. It's something every day, Doug. You know that. This is an ever-going pandemic. We're now dealing with the UK, United Kingdom, and South Africa is here in Fort Bend. These are highly contagious. So as I go back to Washington to be able to highlight these public-private partnerships, I encourage you to be a messenger of one or many. I encourage you to highlight Texas Southern University, which was on the list. And let me thank the Biden administration who took my delivery bill to utilize FEMA to put the 6,000, I wish it was 600,000, 6,000 doses. That does not take out of his allotment or the county's allotment or the state allotment. FEMA will have their own allotment, which is what we said, and they'll continue until the end, every single day. And I hope that we will push them to do those satellite FEMA sites to complement the work that you all are doing here. So I am delighted. I see they changed the backdrop. It was a beautiful mountainous backdrop that we had here. I know that must have been my trusty chairman. He has such a vision for the outdoors. And I was going to use that theme and saying, keep it up, because it gives us the opportunity to dream that someday we'll be on that mountain just laying back, because everything will have been resolved. And until we get people back on their feet, they will continue with hunger. They will continue to need stimulus packages of $1.9 trillion. They'll continue to need increase in minimum wage. They'll continue to need opportunities for jobs. But right here today, if I had that backdrop, though the maroon and gray is pretty strong, I would say today is a place of hopes and dreams. And we are grateful to be on the hope and dream side of the equation. And we hope and dream not only for those over 75 and those with underlying conditions, but the phone calls that we get from a father that I got this morning. Can my 2 children come? I said, just hold on. I said, they have any underlying? He said, well, I guess they'll have to wait. They don't have any of that. But people are panicked. And so I would say we're on the side of the ledger of hopes and dreams, and you all have provided us with that opportunity. And we hope that this will spread like wildfire, good wildfire, and we'll see these sites springing up all over our community. And the only thing we ask is, I know it looks like we're doing a lot, but just embrace us, interact with us, let us help you work with the sites that could be a beneficiary to all of these people who are now in a panic mode. Good thing to get vaccinated, vaccinated, vaccinated. Wear your double mask, socially distance, wash your hands, and don't panic. We're on the way for vaccinating you, but while you're not being vaccinated, get tested to stop the community spread. I'll see you on Saturday. Get tested to stop the community spread. God bless all of you, and God bless the United States of America.
Thank you, President Huewitt. As I was sitting there listening to the kind words of the mayor, and I echo those same sentiments, my eyes started to leak. I will not admit to crying. And I'm always so very honored to be in the presence of my sister, my soror, the Congresswoman, who is, what can you say? But I want to say that actually Texas Southern has been a part of my life. I went to TSU nursery school and graduated with a master's and a doctorate from Texas Southern University. And this was certainly a playground for me. This campus was my playground. And on a sad note, 2 years ago today, my brother was stricken with a stroke and was in the care of St. Luke's. I cannot let you know how important that was for me and my family, the quality of care that he received. But I want to say the Congresswoman has many children in regards to her constituency, from, I think, the Beltway and on through Humble, as she explained. The mayor has 11 children in council with the district count. And I don't want to say which is his favorite, but certainly I do see a great deal of him and his influence in the district of destination. But I want to say that District D is my only child. And if you are a parent, you understand what it means when it is your own child. I get countless phone calls from people in my neighborhood, and I actually live in the neighborhood, which is why I'm dressed this way, because I plan to walk back home. But I get so many phone calls, and this opportunity and access for this community I cannot express. And so thank you so very, very much, everyone who was instrumental in this happening. People have been so excited about Texas Southern, and everybody, of course, knows where it is. And so I just thank you for this opportunity. I am so very honored and humbled to be the council member for District D. And I certainly look forward to us getting past this pandemic so I can again engage in the activities at Texas Southern University. Thank you so very much.
I just want to make an announcement that, Albert, that I think is very important. There's a lot of debate about teachers being vaccinated. Texas Southern University has a School of Education. It reminded me when Councilmember Shabazz was talking about her degree. We are not blocking teachers from getting vaccinated. And if you're in the sound of my voice as a teacher, you have an underlying condition, you can come and get vaccinated. The debate about teachers is overall, and I think this is a perfect site because there are probably a teacher in every block in this area. We grow teachers. So here we are at Texas Southern University. I think you can be the home of teachers who fit into the 1A and 1B, who are still out there teaching. Come on and get vaccinated.
Number one, there's a tremendous demand across the city. And there's been a lot of conversation about vaccine hesitancy, but let me tell you, there's a huge demand in every community, communities of color included, for this vaccine. If you're Hispanic, there's a huge demand for it. If you're African American, Asian, there's a huge demand. There's a huge demand for people in underserved communities, very diverse communities. And quite frankly, what we have said repeatedly is that the fact that in many cases you have these communities that are not getting it as quickly, that's leading to the vaccine hesitancy. But when people see their relatives, their neighbors, their friends getting the vaccine, and then a week or two later, they're saying, look, I'm fine, no problem, everything is good, then that then encourages their relatives, their neighbors, their friends to take it. Case in point, use an example. For example, one of my sisters. My sister said, brother, when you get it, and I know you're still alive and fine, then I will go and get it. So I got it. I was fine, doing great. And then she come telling me, then how can I get the vaccine? I said, I thought you didn't want it. She said, well, now that you're still walking around and breathing, okay, things are good. So it just adds to the huge demand, limited supply. What this site means is that when you make it available, access becomes important. When people can make their appointments and they can walk to, as the council member said, they can walk to, they can drive, they can take a bus, you name it, and you make it available in their respective communities, it makes all the difference in the world.
Mayor, you mentioned numbers on death toll. Hispanics have almost 3 times as many more deaths than others. Can we expect to see one of these sites go up in a predominantly Hispanic?
Absolutely. As you know, for example, with the City of Houston Health Department, we allowed Nueces Casas de Amigos site on this coming Saturday. We're going to be partnering with Harris Health. We'll be in Gulfgate, heavily Hispanic area. And the goal is to have these type of sites all throughout the community to make it available for people, communities that have been disproportionately impacted. The significance and why I'm so proud of this site is the partnership that's involved. When you have St. Luke, and just a disclaimer, my sister works at St. Luke, not the one that didn't want the vaccine, okay? But when you have an institution like St. Luke, and we have the largest and the best medical center in the world, okay? But when you have a St. Luke extending itself beyond its walls into the community, into these neighborhoods, I can't tell you what that means. And when a St. Luke's partners with a historical institution like Texas Southern University, when that partnership takes place, it speaks volumes. It's not only providing the vaccine, but it's also saying that some of our greatest medical institutions can partner with one of our finest historical academic institutions to serve communities that have been underserved so very, very long. It's a shot in the arm, so to speak, for everybody across the board. And that's why I am so proud of what the president is doing, along with the CEO and their teams in making this happen. It will go a long way at reducing the disparities, the inequities that exist not only in this city, but across the board.
Mayor, before you leave the podium, I just want to ask about weather real quick, obviously, in the coming days. Where are we at with the Office of Emergency Management and warming centers, things like that, top repairs?
There will be some announcements coming out over the next day or two. It's going to be cold, okay? It's going to be real cold. So we will be setting up, for example, we'll be very sensitive to people who are homeless. We've got about 1,500 to 1,600 people who are on our streets, and we need to provide avenues to get them off of our streets, those who will come off the streets, and put them in a warmer environment. So we're working in that regard. We expect Monday and Tuesday to be the coldest day. So we want people to be weather aware, weather alert. It may not be the best day to drive on Monday and Tuesday, but people need to be weather aware, weather alert. Even when it comes to our testing and vaccine distribution, there may be some temporary delays for Monday and Tuesday because of the weather. So there are a number of things that we are taking a look at, how it will affect, for example, all outdoor activities, solid waste pickup, basic services. So between now and tomorrow, expect some additional announcements that are coming out. We want to encourage people to wrap your pipes, okay? That's important. I may be the mayor, but I still had to get out there this morning, wrap them pipes, okay? So weather doesn't care who you are. Wrap the pipes, all of those external elements that even the pipes up in the attic, be very sensitive and mindful of that. So there are a number of messages that will be coming out from the Office of Emergency Management, starting today, certainly tomorrow, and then I'll speak more to it tomorrow when we get kind of closer to see what the weather will be like. But we expect cold Saturday, Sunday, Monday, Tuesday, with Monday, Tuesday being the days that we're really focusing on.
So over the last 2 days, we've vaccinated a little over 1,200 people here. And for everybody who was not able to get a vaccine, we're able to schedule them and register them so that they can come back and receive a vaccine. Elizabeth Youngblood, President of Baylor St. Luke's Medical Center. So the state allocates vaccine on a weekly basis. And so we understand every week how much vaccine we're going to have, and then we take that vaccine, bring it here, and then we know how many appointments we can make.
Let me add to this comment. I think it's important to emphasize the collaboration. The vaccines come from the federal government, and then they come to the state. Now, we have promised 600 million doses. We want to see these doses ramped up. So that means that St. Luke's will have a ramped up amount. The city will have a ramped-up amount, and we will not be exclusive, meaning we will not take from St. Luke's as the state has designated their proportion. It'll go up, and the cities are supposed to go up. Harris County is supposed to go up, and then the federal government with FEMA is supposed to be aside. Let me be very clear. This is very important. We are the first cities to get the mega sites. New York, LA, Dallas, and Houston. Houston and Dallas were announced, as everybody knows, yesterday. That's a big deal, and that is a tribute to the work that has been done here, and it is also a recognition, I keep saying it over and over again, of our numbers that are so low as it relates to the critical population. 5.4%, Hispanics are in the same level, but also Asian Pacific, Southeast Asian, the infection rate is not as high. But we have got to make sure that we do critical populations, and these kinds of facilities with the doses that's being given will be instrumental in doing so. One of the things that's important that I don't want to leave out, and I want to say this publicly, we need to be using faith institutions. We need to be using facilities that are near faith places because they are comfortable for people, and they are in neighborhoods, and they're big. Their facility is big on the outside, temporary facility, the Episcopal diocese, obviously. There are other faith efforts that could be utilized. That is the comfort level. That's why we weren't getting African Americans, Hispanics vaccinated. You were not going where they were comfortable. And that's what we have to do. And this is a fine example of that. But it is a university, but it is in the neighborhood. How many of them are located in the neighborhood? That's a very fine statement to make, and we should continue that over and over again. We will provide the doses. We're going to keep pushing those doses. Again, commitment is 600 million doses sometime leading into the summer.
Here that I'll have it right here. Councilmember Shabazz, and here we are today. Step one, I'm sure the mayor would agree, and you will agree.
Stations.
So we have over here, as you walk in here, you'll see. So now you have all your paperwork at this point. You're ready to go ahead. Get vaccinated and here so each one of these cubes are in the refrigerator. It gets helium added to it. Doses are drawn that are good for a few hours. And as soon as the patient is ready, you see patients are lined up behind you. The nurse will approach, or behind you, my pharmacy student who also immunizes.
Okay.
And they go to one of these cubicles. They get their injection, and they get a little card because they have to come back in 21 days.
Okay.
And that's our process.
So these are all the makeshift stations right here.
Correct. This room used to be a student lunch. That is one.
And so the flags that say once it's been diluted, it can within 6 hours.
You have to use it within 6
So-
hours, so we actually have it labeled, and we have the time
There's a time
here
on it.
for
Okay.
expiration with the date.
Okay.
But
So-
it gets used up pretty quickly.
When we get towards the end of the day, they're not going to deliver while unless they are sure, that there are enough patients. Because each one of those vials gives you 5 or 6 doses. We're not wasting a single dose.
Okay, good.
And the other day we needed a 5th person. I found that 5th person to be here. We will not waste a single size bit. Right now, of course, we're going through the operations, but towards the end of the day, we're very careful not to pull another vial. And these are refrigerated in the morning to dilution to draw in the dosage.
And each one of these files can produce how many?
5 to 6.
5 to 6. Good.
So and this is Pfizer that you have?
This is Pfizer.
And then what kind of card and registration are you giving to them for them to come back, and where will they come back to for their second dose?
So they get an email. So they get a card as a reminder card, but they will also, once they're registered, once
I'll
they're
get the card.
Yeah, can show them. Once they are registered in the system, they automatically. Am I right? Oh yeah. No, this is, we offer the College of Pharmacy because you know our students, one behind you, Jamie, who's been here working, they have the certification to do it now, so they can actually help out. So all the classes
Thank
being
you,
online,
Jamie.
all the classes being online.
No, no, this is great.
And if you have
And the good news is that they're going to be here at Texas Southern for a while. I think they've signed like a 4-month contract. So between St. Luke Health and Texas Southern University, they'll be here for several months, so people can get their shots, and then they'll come right back for their second shot, you know, right here. So, yeah, I do like what I see.
Is this going to be your first vaccine? Yes. All right. What's your full name? Ron Carter. Mr. Carter, and your date of birth.
So today is March, every 2/11, you're gonna come back.
Oh, perfect. Let me get the vaccine. Bring your arm this way. There you go. There we go. 1, 2, 3. Great. Put a Band-Aid on there. So you're going to return March 4th.
Are you glad you got the vaccine?
Very much so. Go show this.
Thank you. You went 6:42. Yeah.
Nope.
Have you had COVID infection?
Nope.
Have you had other vaccine? Yes.
How was it?
Perfect. You're good.
Thank you. All righty. So I got your card right here.
Okay.
Your next dose will be March 4th, 2100, same time, same place.
I did back on January the 9th. Did a telephone call, and I had a young lady on the other line. I say young lady, being I'm elder, but anyway, she said I'll work it in, and she did, and here we are. So.
And you're glad you got it?
Very good. Thank you.
Can you tell me that so my voice isn't asking the question?
I'm sure. I'm very glad that I was able to do it. I'm 78 years of age. I'm healthy. So I'm very blessed, and I thank you.
What's your name?
It's Fabia, Fabia, Harold, like a first name. Harold. Fabia Harold.
Thank you so much.
It was painless. He's very gentle. He promised to be gentle, and he was.
All right, let me give you.
You're welcome. All right. My name's Madison Hernandez, by the way.
Okay. Shoot me an email and I'll have it.
Sorry, excuse me.
That's all right. I'll hand you back whatever. All right. Have a seat. Have you had this?
Okay, great.
I got it. You got a little bruise going on already. Was that from another vaccine?
No, I haven't had any shots.
Yeah, you have a little bruise.
Well, I'm on blood thinners.
Great. You did awesome.
It's over, huh?
Yes, sir.
You did good.
Thank you. I appreciate that. Let me put a Band-Aid real quick. Okay. Not that you're bleeding.
Thank you.
Are you glad to get the vaccine?
Absolutely.
How's it feel knowing you're halfway there?
Well, It means I'm one step closer to all the way.
It does protect you a little bit.
Well, it protects us a lot from what I've been reading. No, I'm just saying,